Hi, I'm Christina. Welcome to this episode of Women's Health, Wealth, and Happiness Interviews to Inspire. Our next guest is a remarkable energy intuitive and anesthesiologist with over 25 years of experience, blending the precision of medical practice with a deep understanding of the mind body connection. By giving factual information, she helps busy superwomen navigate surgery, helping them to set intentions and approach their procedures with clarity and confidence. For her, true health is radiant, reflecting a state where we're wholly healthy, body, mind, and spirit in harmony. Kaye knows about embracing each moment as it is, and wealth is being happy with who and where you are. She understands happiness is our natural state, a place we can all return to with the right mindset. Please join me in welcoming doctor, surgery coach, and owner of Oshun Energy Medicine, Kaye.
Hi, I'm Dr. Kaye Brundage. I am very happy to be here.
Great. Tell us a little bit more about you.
Sure. As you mentioned, I'm an anesthesiologist by training. As far as subspecialty, I actually have specialty training in neuroanesthesia as well. So, doing anesthesia for the brain and spinal cord. I've been in practice for over 25 years. I've practiced all across the country. And I have found that the skills that were with me from the time I was a kid, meaning the intuitive skills, really helped me amazingly in my medical practice. It was an interesting journey as I kind of balanced the science and the facts of medicine with the art of learning about alternative and complementary medicine. My yoga practice, which I discovered early in my years in practice, really sustained me throughout my years of practice and also sparked my interest in looking at other modalities of complementary medicine because I always instinctively knew it wasn't just all about the science. I always knew that that mind-body connection was something that could be harnessed and combined with scientific Western medical thought to create a more powerful and more well-rounded outcome.
Kaye, your health word is radiant. Tell us why you chose radiant as your health word.
Radiant implies that you have got that special spark that all of us are given from the minute we're born. That enables you to glow from the inside out. It's fine to put on makeup. Everybody likes to enhance and downplay their not so favorite spots and enhance their wonderful ones that they love. But true radiance actually it comes from within. And so I look at it as shining that light from the center of your heart to your whole being. And that means shining it out through your eyes because the eyes are the window to the soul. And also having that heart-centered approach to your life that truly does affect everything that you do, how you relate to other people, and also affects just your overall health, well-being, and maintenance. It is just a matter of when you have that radiance, when you have that inner light, it truly shines throughout your life to create health, happiness, and people can see it coming a mile away.
It's so true. I mean, you think about even the everyday, you have a cold, you have a flu, you had some little boo-boo. And once
Right.
it gets better, how much better you feel. And you start to, oh, yay, you're just happy that you're back to your full self. How do you cultivate radiance in your own life?
I cultivate radiance by respecting my need for time alone, for time with nature, and time spent in silence and also doing the things that I love. So I think just doing what brings you joy and makes you happy. There's an old song called This Little Light of Mine, I'm Gonna Let It Shine. They teach it to kids. It's not just for kids, it's for adults too, because when you let your light shine, so that you're bringing that light with you everywhere you go, people know, they can sense it. It is radiance, happiness. It is a palpable emotion that people can feel, and it can go and be carried in front of you everywhere you go.
And your particular career is very, very interesting because you're teaching people who are preparing for surgeries on how
Correct.
to get that radiance back. Tell us more about this.
Yes, this is a passion of mine, my whole career actually, is connecting with my patients and helping them get through the perioperative period, which is the period around surgery. People have so many fears, so many concerns around this time. And I'm an observer more than anything else. And I just would observe what would happen, for instance, in the preoperative area, where I saw so many women, particularly taking care of everybody and everything, and they took care of their families. They got their kids squared away. They got their work squared away. They dealt with everything in that preoperative area. And because I was one of the people responsible for helping transport them in, that's how it works when you're an anesthesiologist. I would also watch their eyes get big as saucers when they finally got into the operating room, and lots of tears because they really hadn't taken time to prepare themselves for anesthesia. So that's where all of my yoga and meditation and centering and qigong, all of that training came into play, because then I did the breath work with them to ground them, because I knew that they had gotten themselves in a situation where they were in flight or fright mode. They were holding their breath. They were tense. They were very much what we call disconnected. So just kind of head floating above the body, not connected with the body. And my job was to ground them, to connect them with the mother of us all, Mother Earth, and to ground them, to teach them breath work that would be sustaining and healthful, and get them to focus on the most positive outcome. We wouldn't talk about the surgery. We wouldn't talk about fears, because fear is a four-letter word that is worse than I think any swear word. It's awful. It has so much capability to paralyze and divide people. But love, if you focus on love, you do your breath work, you set a positive intention, the universe tends to feed you exactly what you're giving out. So if you radiate anxiety and fear and, oh, I don't know what I'm going to do, and tension, you're going to get more of the same. So the universe is very obliging in giving us what we ask for. So if you ask for love, positivity, and you say, I'm going to go through this surgery, I'm going to do my mindset, and everything is going to go great. I'm going to have a great outcome. My pain is going to be controlled. There are not going to be a lot of side effects. I'm going to do great. Rehab is going to go great. And I really can speak to that with some authority, because that's exactly what I did when I had to have surgery after a ski injury. I just resolved at the time of the injury. I knew who I wanted to be my surgeon, and my resolve was to do everything possible to prepare myself to make sure that everything would be as physically as good as I could make it. And then my mindset was the surgery is going to go great. The recovery is going to go great. Not going to have much. Yeah, exactly what I just told you. That was my mantra. I found out later that I became his poster child for navigating surgery and recovery in less than, I'm not going to mention the number of months, but not too much longer after my surgery, I was climbing a glacier with crampons. And less than 9 months later, I was back on the ski slopes on blue runs and having a grand old time.
That is an
That
incredible
is
story.
100% true. And my surgeon asked me, he said, I don't know what happened, but everything went perfectly. And I told him, I said, yeah, that's what I focused on, everything going perfectly. So it did. And he just looked at me and he's like, well, okay, I wish everybody would do that. So that is how I got the idea for my business. It just kind of went from there.
You mentioned intuition. So, how does intuition help you with what you're doing?
It's the funniest thing in the world. I can look at a patient and know when we're going to have trouble. I call it the look. They have the look. And when they have the look, I am on guard. I don't necessarily always know 100% what's going to happen, but I extend all of my senses and I listen and I watch for everything. One of the things that a lot of people don't know about me is I was also a music major. I was a music major as well as a chemistry major, so double major in college. And I played violin from the time I was, I don't know, 8 years old. So pretty serious violinist for a long time. But that musicianship taught me to listen very intently to everything that goes on because there's all kind of tones and beeps and whistles. And even if I'm not looking, I've kind of got those ears that go on. It's an anesthesia thing, but also a musician thing to be aware of what is going on around you. And all of that has really, really helped me to be a better doctor and also to be intuitive and empathic also with my patients.
Mental health is also one of those things that is talked about much more often now. Tell us about your feelings and radiance and what it means in health to you.
To make a whole connection, it truly is mind, body, and spirit. We have to have sustaining practices that are meaningful to us and help us be better human beings, more compassionate first with ourselves, because if you're not compassionate with yourself, you really can't be compassionate with others. You have to have self-love, because of course, love begins with self and then it can be extended out to others. It's only when we're healthy in mind, body, and spirit, and mentally as well as physically healthy, that we can be that radiant human being that we were brought to this earth to do and find what it is that only you can do on this earth, which is why you're here. I mean, and I think that's something that people don't necessarily think about a lot. You're the only you there is. So you have to value yourself and you have to contribute something both to current generations and to future generations. And if that means taking care of people, it doesn't necessarily mean that, everybody's obligated to do the same thing because we're all different. We all have different talents. For some of us, it means that we do whatever we do to the best of our ability and bring a little light into the world. Whatever you're doing, that's what you're supposed to do. And that's what I just try to do. And, if you need help, there needs to not be any stigma about any kind of mental health issues because mental health is human health. It's important for all of us. And especially as we continue to recover from all of the trauma and stress, we all need to know that there are scars, there are visible scars that are no less significant that have been left, that have affected all of us, and we must address them. I think probably the only really good thing that came out of that whole experience is the fact that so much of mental health care now is accessible online. It is a lot easier to find a therapist and do online therapy sessions than it used to be to schedule it into your time schedule and to go there and whatever. It's a lot more easily accessible now. So I'm really hoping that people really avail themselves of that opportunity to have that aspect of their total health addressed.
Indeed. And what's interesting back to that connection is when you're not doing well mentally, there are physical things that happen. And
Yeah.
same thing, when physical things are happening, it's affecting you mentally, your
Yes.
emotion, all of it. It's really, when you think about it, it's so simple. It's connected.
Right. We're connected. It's like you cannot connect the malfunctioning arm part away from the malfunctioning heart that is upset because the arm is malfunctioning. We are a total organism, and I really try to look at that approach both when I'm taking care of my patients and also when I am coaching my clients through the surgical process because we've got to take care of the whole body. And I think that taking care of the whole body is going to lead to healthier human beings and healthier citizens because if you're a healthy human being, then you can be a healthy citizen for your community. And that is all important because we're all about communities. It's about not the individual and what the individual can do. It's about community. and the power of community. One of the things that I've discovered is all of the allied health professionals that are out there to help all of us. I've got a naturopath, I've got a chiropractor, I have worked with an acupuncturist, I work with a meditation coach. So, yes, I work with all of these people because they help me be the best person that I can be. And I get out into nature because nature, goodness gracious, the best physician of all.
And if you had to give somebody advice to getting back to being radiant, how would you tell them this is some steps you can take?
First is get yourself a morning routine because I've always been of the opinion that you don't go taking care of anybody else until you have taken care of yourself. And I really credit former First Lady Michelle Obama with that because I read that in her book, how she, even with having kids in a very challenging profession, would get up at 4 o'clock, 5 o'clock in the morning and work out before she started her day. So I can't always get in a full workout first thing in the morning, but I do take time to get out into nature, to connect with what is outside, to breathe and to relax, and to have some time to do a little meditation, to do a little bit of qigong, to do a little bit of centering. And I, what I call prepay my day. I have in mind that, okay, this is how I want my day to go. That's part of me being able to face a challenging day and a challenging profession and challenging times. It's really starts with being quiet and centered and focused on my own well-being before I take care of anyone else. And also lots of hugs and kisses from my four-legged family of cats and dogs.
Stay tuned to part 2 and learn about the wealth word for this interview. Subscribe and click the link below to find out about bonus tracks and how to join our community.